If you got one tooth acting up, like 1 out of all 32, this one little tooth has chosen chaos. Stay right here, because when a single tooth starts screaming, it's really trying to tell you something important. Hey y'all, it's Dr. Fatima from CEPI, the Center of Endo, Perio, and Implantology. And today we're going to answer a question that shows up in my office, my DMs, and all over Google. Why does only one tooth hurt? Because listen, when your whole mouth is sensitive, that's one thing. But when one tooth starts acting up, it's on its own personal journey. And that's when people start to panic. So let's break this down really quickly, really simply, because that one tooth might be telling you something important, and it's not always what you think. First, let's talk about pain versus sensitivity, because you know what? There really is a difference. Ouch! Cold water hurts this tooth, and this tooth hurts when I bite, and this tooth hurts for no reason at all. Different patterns tell us different things. So let's go through the top reasons why one tooth would decide to act up. Number one, a cavity you can't see, because really cavities are sneaky and you can't always see them. They don't always show up on the surface, and they don't always hurt right away. Sometimes the only symptom you get is sensitivity to cold or sensitivity to sweets, or one tooth that just keeps giving you attitude. If it's just one tooth that's sensitive to sweets, cavity is probably the first thing that we're going to check. Number two, a cracked tooth, and really that's a big one. One of the most common causes I see. And listen, cracks don't just show up clearly on x-rays. You can have a crack and the x-ray can look clean as a whistle. A cracked tooth usually gives you sharp pain when you bite down, relief when you release, random sensitivity that comes and goes, and pain that moves depending on where the crack flexes on your tooth. So people who grind, chew ice, or bit down on something weird, this one's for you. Number three, gum recession on one tooth. Remember how I said exposed roots are dramatic? If recession hits one tooth harder than the others, you'll get an isolated cold sensitivity, and that tooth feels like it's in its feelings every time you drink cold water. This could be from brushing too hard, clenching on that tooth, or having thin gum tissue. Number four, when the bite is off or you have a high spot. So common, so misunderstood. Maybe you've had a recent filling or a recent crown, or you've been grinding at night, and now one tooth is hitting harder than the rest. And that pressure irritates the ligament underneath the tooth. The tooth gets tender, kind of like a bruise. One of the easiest things to fix, we adjust your bite and the tooth calms down in days. Number five, a sinus issue that's trickling down. Yes, sinus problems do hurt one tooth, especially the upper back teeth. If you tap on one tooth and the whole row hurts, sinus. If cold air makes your face ache, sinus. If you've been congested, definitely sinus. Your body loves to mix dental drama with sinus drama. Number six, a gum abscess. Not all infections come from cavities. Sometimes the gums will get infected between two teeth and you might feel a swollen spot, tenderness, pain when you bite, or you even might get a little pimple on your gum. This is a gum abscess, and it can make one tooth feel like the enemy. Number seven, a dead or a dying nerve. Now this is important. I know it sounds scary, but it does happen. If a tooth had trauma, a deep cavity, or chronic grinding, the nerve can get irritated and it will start to die off. Signs might include pain when you wake up, throbbing pain, lingering cold sensitivity, or even heat sensitivity that hits hard. That tooth is not shy. It will let you know something is wrong right away. And then number eight, something stuck between the teeth, like popcorn, seeds, almond slivers. Those are the tiny villains normally. And they can cause one tooth to be quite tender, quite sore. It can even swell your gums or irritate the area when chewing, and pain way bigger than the actual cause. It's funny how something the size of a comma can create pain the size of an entire paragraph. And then number nine, a failing filling or a crown. You know, dental materials do age, margins do leak, old work does break down, just like a car. And then what do? The tooth gets sensitive or painful, usually in one very specific spot. Now, what's the plan if one tooth is acting up? Well, here's what you do. Pay attention to the trigger. Is it cold, biting, sweet, or is it random things? Gently floss the area. Sometimes something may be stuck. Check for swelling or a bump on the side of the gum. Avoid chewing on that side temporarily, and then use sensitivity toothpaste. If it hurts when you bite, call your dentist as soon as you can. It could be a crack or a high spot. If the pain wakes you up at night, get seen as soon as possible. That could be nerve related. Tooth pain is not something to play with. It might be minor, but it might be your tooth trying to save itself. Now here's our final takeaway. When one tooth hurts, it's rarely random. It's usually your body giving a specific warning sign, and with the right diagnosis, we can fix it. But don't guess, don't ignore it, and please don't diagnose yourself using TikTok. If this helped you understand why one tooth keeps cutting up, hit the like button. If you know somebody who keeps saying, this one tooth just doesn't feel right, send them this video, share it with them. You might save them a world of trouble. And if you want more real, simple, and honest dental talk from a periodontist who keeps it relatable and understandable, make sure you subscribe. Turn on your notifications so you don't miss the next one. All right, y'all, till the next time.